How do you know if you have depression? I'm Samantha Catlett with Circle High's Digital Media in December 2012. According to WebMD.com, you could have depression if you have the following symptoms: difficulty concentrating, excessive or inappropriate guilt, and irresponsible behavior, loss of appetite, not sleeping, sadness, anxiety, or feelings of hopelessness. Now I would like to introduce Mr. Reed, the lower-classman counselor for Circle High School.
Sometimes it is hard to identify depression. I think high school students are pretty good about hiding it for the most part. But like I just mentioned, I think that students who have low energy, poor grades, they're not sleeping well, I think those are the 3 or 4 key indicators that a person might be depressed. If it's like clinical or major depression, I usually will get a hold of the parents and we'll have a conversation, and I refer them for professional help. And there's some very good adolescent counselors in the area that we can refer them to, and we've had a lot of success. Usually there's we have a really good relationship with South Central Mental Health, which is located in El Dorado and Andover, and so it's really handy for our parents and students to meet with counselors there. Other than the counselor, they can talk to anyone. I encourage students to develop a good relationship with some adult in the high school, one that they feel comfortable with and one that they can feel like they can share with, in an area of confidentiality. It doesn't always have to be a counselor. There's always a lot of caring adults that work around here. So that's always my recommendation, is that they find some adult to talk to. I think the number is probably higher than what some people think. I think there's quite a bit of depression at the high school level. To put a specific number on there, that would be hard for me to do, but I do think there's a lot of students walking around with depression and may not even know it.
According to kidshealth.org, there's a difference between sadness and depression. Feeling sad, down, or discouraged are natural emotions. That's sadness. Depression is a strong mood involving sadness, discouragement, despair, or hopelessness that lasts for weeks, months, or even longer. According to WebMD.com, teens can develop symptoms of depression over their grades, school performance, social status with peers, family life, or even their sexual orientation. Depression usually starts between ages 15 and 30 and sometimes can run in families. It is actually more common among teens that have a family history of depression. 1 in every 33 children and 1 in 8 adolescents may have depression. Teen depression is treated like any other person with depression. The treatments could be medication or psychotherapy. The healthcare provider determines what type of treatment is best for the teen. One type of treatment is using Prozac. The second would be cognitive behavioral therapy, or CBT. The third approach is a combination of the medication and CBT. More than 60% of kids who take Prozac alone improved. The combination treatment is typically twice as effective, according to studies. 30% of children and teens receive any sort of intervention or treatment. The other 70% struggle through depression, trying their best to make it to adulthood. Depression is often the main cause for suicide among teens. 500,000 teens attempt suicide every year, with 5,000 succeeding. Suicide is 100% preventable. The main types of depression that occurs in teens are dysthymia, bipolar disorder, and reactive depression, says depression.emedtv.com. Dysthymia is a less severe type of depression that can be long-lasting. It often starts during childhood or adolescence. With dysthymia, the adolescent is depressed for most of the day on most days, and symptoms continue for several years. Bipolar disorder is the least common type of depression. Teens that have it experience cycles of mood changes alternating between mania to depression. Reactive depression is the most common form of mood problem in children and adolescents. The child may feel sad or lethargic for periods as short as a few hours or as long as 2 weeks. Now, some thoughts and answers about depression with sophomore Jamie Larson.
I avoid people usually, and I don't know, it's just I seem a lot more negative about things. Getting out of the house, staying in the house is probably the worst thing to do when you're depressed.
When did you first notice that you might have depression?
Probably right after my dad died. Avoiding people, staying in my room a lot, and then just like, I don't know, very negative outlook on life. I don't know, just like everything I think about the worst things possible, and it just gets me even more down. Yeah. I talk to my friends mainly.
When does your depression mainly start acting up, if it does?
Usually around like the birthdays of my dad and father, or like holidays, just because we were always with family then. Talk to someone. You do not want to just deal with it, because bottling emotions up is the reason why people start self-harming and sometimes commit suicide. It's not something you can just get over. You have to talk to someone about it, or it can get much worse. You're not alone if you have depression, and you should definitely seek help because you don't want it to get any more serious.